welcome to another webinar presented by the Youth Advocates for Global Health Association. I'm Jonathan Wang.
And my name is Matthew Yu, the Vice President of the organization and co-host of today's webinar.
You know, Matthew, believe it or not, it's already December 1st.
Gosh, is it really December 1st already?
I know, wow, time really flies. Wow, yeah, 2024 has been quite a year so far. And as we transition into the winter season here on the West Coast, it's a fitting reminder of the broader climate changes our world is facing. You know, these shifts aren't just about colder winters or warmer summers, they're intricately linked to global health, which brings us to our crucial topic for today's webinar, the impact of climate change on global health inequities.
Before we dive in though, I'd like to remind everyone that you can submit questions throughout the webinar using the chat function. We'll address as many as we can during our discussion today.
Now it's my pleasure to introduce our guest, Sandra Smiley from Doctors Without Borders. Sandra, welcome to our webinar. How are you doing today?
I'm well, thanks, Jonathan. How are you?
I'm good. Thanks for asking. Wonderful to have you here.
I want to acknowledge first and foremost that I'm coming to you today from the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh people. I'm so grateful to live on these incredible lands and to the Indigenous peoples of this area who have acted as the stewards of these lands since time immemorial. And for everybody who's listening today, I encourage you also to reflect on your relationship to the Indigenous lands that you are on and the part that you can play toward the broader project of truth and reconciliation here in Canada. So it's been a pleasure to connect with this group, Youth Advocates for Global Health Association, whose vision I got from the website is to establish a united global youth community committed to advancing global health equity and fostering human health and well-being. I think this is a really great goal because, of course, in the world that we are living in, we're faced with a lot of inequities, many of them pertaining to health. And if you, like me and many others do, see health as a human right, then you'll see this as something that needs to change, especially given that there's really no reason for this. Today, almost a quarter into the 21st century, we have access to a huge amount of knowledge and scientific technology, as well as resources, unlike we've ever seen before. And as many will also know, the times that we're living in are unprecedented for a different reason. And that's because we're living in the era of anthropogenic climate change. Now, this issue is real, and like health equity, it is deserving of the application of our abundant knowledge and resources. And as I'll explain to you today, I see advocacy in favor of health equity and advocacy in favor of climate action as two sides of the same coin. But first, that introduction. So my name is Sandra Smiley, as you already mentioned. I use she, her pronouns. And I'm a final year medical student at the University of British Columbia's Vancouver Fraser Medical Program. And before I went back to school 5 years ago to retrain as a physician, I worked in global health. During that time, I was primarily working for the organization Médecins Sans Frontières, Doctors Without Borders, which is an independent international medical humanitarian group. I worked in communications and advocacy, and I was part of teams who were responding to people's immediate needs during and after crises like conflicts, disasters, and epidemics of disease. And on the surface of it, the links between these crises and broader environmental factors or the climate weren't always obvious. But if you started to move back a little bit in the chain of possible causality, if you started asking why, it became clear that the environment and climate change was likely among the driving factors of many of these crises. And I'd be happy to tell you more about some of these experiences during the Q&A portion of this presentation. But these experiences really ignited my interest in the environmental dimensions of health and health equity. And since I've been in medical school, I've been part of a group called UBC Medical Students for Climate Action. The group's mandate is to promote the integration of content on the environmental determinants of health within medical education, with a view ultimately to promoting health equity and building a more sustainable healthcare sector. On our website, there are open access modules on climate change and health topics that are free to use by medical learners and by the general public. And if you'd like to check them out, you can visit ubcmedicalstudentsforclimateaction.com. And maybe we can also share a link on the website. So, climate change. We know that it's happening. This is a quote that appeared in the IPCC's 2021 report, confirming the occurrence of climate change and its anthropogenic nature. Now, what does that mean? What is anthropogenic? It means that the climate change that we are experiencing and that the IPCC is documenting is caused by human activity. It is not the same kind of climate change that we've seen in previous periods of Earth's history, for example, the ice ages. And the thinking behind anthropogenic climate change is that since the Industrial Revolution in the mid-19th century, the widespread use of coal and fossil fuels has led to increasing amounts of carbon in the atmosphere, which in turn contributes to the warming of the climate. Currently, as you can see here, fossil fuels are the biggest culprit in terms of carbon emissions into the atmosphere. These emissions are mostly used for power, so electricity and heat, transportation, and commerce. Now, as the IPCC told us a couple of slides ago, this activity is having a number of important impacts on the Earth's climate. These impacts are both direct and indirect. As a direct impact, you see here that global average surface temperature is rising despite some year-on-year variation. By the beginning of the 21st century, Earth's temperature was roughly 0.5 degrees Celsius above the long-term average. Oops, sorry. Other direct impacts include warmer and more acidic oceans, more frequent and severe weather events like floods, droughts, and heat waves. And you'll be very familiar with forest fires by now, as we have had some very severe forest fire seasons here in British Columbia in the last couple of years. Hotter and drier weather, as you'll see in this graph, tends to produce more severe fire seasons. And now there are also believed to be many indirect impacts of climate change. These are things like economic losses and food insecurity, conflict, and migration. These are active areas of study and advocacy. As you can see here, the UN Migration Agency and others recognize the role of environmental factors in the multifactorial decision of people to migrate. Now, all of this is having an impact on health. This is a schema from the US Centers for Disease Control that provides an overview of some of the health consequences of climate change. It's important to note, I think, how diverse they are, as they range from mental health distress to changes in patterns of infectious disease to exacerbations of more chronic health conditions like cardiovascular disease. So the health impacts of climate change are multiple, and the burden of health risks related to climate change and environmental degradation tends to be unequally and inequitably distributed, both globally and within countries and communities. At the global scale, lower income countries tend to be the worst affected by climate-related disasters. Yet they are also notably those countries which have contributed the least to climate change. And why is this so? Why is it the case that lower income countries tend to be worst affected by climate-related disasters? I like to simplify things, and I think math and equations are a really good way of doing this, although I realize that some may disagree with me on that. As you can see here, Blakey et al. Think about risk as being the product of a hazard and vulnerability. As you can see on the right-hand side, the hazard is a potentially damaging event, say in the context of climate change, heavy rain, or a cyclone, or a heat wave. Whereas on the left-hand side, you can see that vulnerability depends more on the presence or absence of factors that are protective against that hazard. So here I'm talking about things like strong infrastructure, well-trained human resources to help out with the response to that hazard, and the political will and resources that are needed to mount a response. And it's really important to note, I think, that structural factors, things like poverty, like historic and ongoing colonialism and oppression, and other forms of marginalization, they intersect to increase the vulnerability of populations and undermine their ability to prepare, to respond to, and to recover from climate change-related shocks. Within countries and communities now, the people most affected tend to be the people within a society who are already facing barriers to accessing care. Now, in our context here in British Columbia, those people tend to be older people. They are people living in poverty. They are people who have difficult access to healthcare because of geography, like Northern and Indigenous First Nations communities. During British Columbia's unprecedented heat dome phenomenon in 2021, older people and structurally vulnerable people were found to be most severely impacted. As I said just now, climate change disproportionately impacts the health and well-being of Indigenous communities in Canada. And like I said, I think it's really crucial to recognize that this, like other health inequities, are the product of systemic forces like colonialism and neglect that these diverse communities have experienced at the hands of the state. But I think it's also worth noting that Indigenous communities in Canada tend to be located in areas that are close to forest ecosystems that burn frequently. As a result, Indigenous people are among those who are most affected by wildfire evacuation and the stress and disruption that those evacuations tend to entail. These are a couple of quotes from some research that I did not too long ago related to the experiences of First Nations and Indigenous people in Canada during wildfire evacuations. I think that it's conveyed nicely by these quotes how difficult and the kinds of adversity that people face during these evacuations and the disruption that comes with them. As Dr. Nicole Redvers here points out in this quote, despite an increase in climate change-related events in Canada's north, there has not been action that meets the need to make healthcare in Canada more sustainable and resilient across the board. And certainly there's much to be done on this score. The healthcare sector is a major generator of carbon emissions, the same carbon emissions that are contributing to all of the adverse health outcomes that we've just discussed. Canada, in fact, is the third largest emitter of healthcare life cycle greenhouse gas emissions per capita in the world, after Australia and the United States. Healthcare here produces 33 million tons of carbon dioxide equivalents. Most of this is used for energy, including transport, as well as supply chains, so product manufacture, use, and disposal. So recognizing that climate change and environmental degradation perpetuates health inequities in this way, some organizations are beginning to rethink the way that they deliver healthcare and take advantage of opportunities, for example, to reduce their carbon emissions. So in other words, mitigation. And so that can include things like building design, designing physical infrastructure to be lower carbon. That can include the use of renewable energies, things like solar panels. And as a side note, this photo here is from South Kivu in Democratic Republic of Congo, where these two technicians are affixing solar panels to be used to power a hospital to the roof of that same hospital. Other considerations that can be made with respect to reducing carbon output of healthcare infrastructure are waste management, supply chain, and advocacy. This is a story that I put here because MSF is not the only organization that is taking advantage of the power of solar energy to energize its facilities. So in Haiti, Partners in Health, which is also a great organization, are harnessing solar energy in order to power one of its larger hospitals in Mirabelais. And then alongside mitigation, adaptation is another important consideration for making sure that health systems are fit for purpose in the age of anthropogenic climate change. So adaptation is basically the act of creating health care systems that are resilient to the shocks that may come with climate change. So what that looks like in practice, improving capacity to detect threats that are related to the climate, for example, extreme weather and changing patterns of infectious disease. Preparedness, so making sure that there are those trained up human resources to respond to a crisis, and in robust physical infrastructure and planning. Finally, advocacy. A final opportunity for healthcare workers and the health system is to raise their voices to advocate for more climate action and to center and uplift the voices of those who are most affected. The healthcare system is historically focused on curing people, on healing the sick, on fixing problems that are already existing. It has been less focused on factors upstream that cause disease. And I think this is especially the case with environmental factors, as I think the tendency is to see the environment and people as being separate from each other. But it's clear that climate change is impacting health and that it's contributing to health inequities. And it's also clear that healthcare itself is contributing to this problem. That is unsustainable. My understanding is that you all are here because you are future healthcare workers who are passionate about health equity. As you move through your training in medicine or one of the other health disciplines, and your free time and mental bandwidth becomes scarce, you might feel like you have to choose between dedicating that time and that mental bandwidth to better and more accessible healthcare, or for climate action and a more robust response to climate change. From what I told you today, I hope you see that you don't. As Paul Hawken, as quoted in Dr. Paul Farmer, his 2013 book, To Repair the World, says, there is only one bus. To make that metaphor carbon neutral, we're going to make that an electric bus. There's only one of those. Sustainable healthcare is more equitable healthcare. Advocacy for health equity is advocacy for climate action. Social justice is climate justice. Thank you for listening, and I'm glad to have you along for the ride.
Very comprehensive view, and thank you so much for your presentation. Just to trail off of that PowerPoint presentation, I was just wondering, like, what actions can from a more individual perspective, people can do to help address these health inequities exacerbated by climate change?
Yeah, I think that's a really great question. And it really depends on who you are and where you are in your life. I would respond to that question maybe in this circumstance, knowing that people who will be watching the webinar are, as I said, folks who are interested in the healthcare professions and health equity. I think one of the big things that they can do is make sure that they are getting a good, comprehensive understanding of the environmental determinants of health, because it is with that knowledge that they will be able to intervene on those problems in their patients. And it is equipped with that knowledge that they will be the most effective advocates. And then I guess that would be the second thing as well. Within medical education and within the medical field, increasingly there is advocacy for improved or for robust climate action. As we have increased or improved our knowledge of the health impacts and the health equity impacts of climate change. So joining up with those movements and supporting that advocacy by whatever means are available to you, whether that's writing letters or signing petitions or writing to your MP, I think is a great way of getting involved, because like health equity, climate change is not an issue that can be solved by one person. It's really the efforts of the collective that are going to be decisive in changing the current. Great question.
Yeah, definitely. I think there is this individual action, and then there's also the global action, because climate change is obviously a global problem, and global problems require global solutions. And so we need people to tackle on the problem, but we also need to, I guess, have a better systemic approach just overall. Um, I did just want to ask about kind of more the impacts of climate change in relation to health. So, how does climate change affect the spread of infectious diseases, would you say?
What a great question. Yeah, so there are a couple of different mechanisms. And again, it depends on the infectious diseases that you're talking about. I think one of the types of infectious disease that we know the most about are things like arboviruses, so Lyme disease, and parasites that are transmitted by mosquitoes, so things like dengue fever, Zika virus, and malaria. So for the latter, for mosquito-borne diseases, what is being observed now is that warmer temperatures that are warmer temperatures, increased precipitation, changes in precipitation as well, are changing the extent, the geographical extent of mosquito survival, which could be factoring into more widespread outbreaks and outbreaks in locations where there haven't previously been outbreaks, which can be really problematic from a health perspective. The reason being that in many countries where some of these parasite diseases are endemic, people over the course of their lifespan develops a form of resistance. Their immune systems become trained to respond to the exposure to that parasite. And as a result, their bodies are better able to mount an offensive, and they typically have a shorter and less severe course of illness when they do get sick. But in situations where those diseases are appearing, where they haven't appeared before, people don't have that kind of immunity. And so they tend to get much sicker. And I actually had an experience while I was working for Doctors Without Borders where we saw something like this. And it wasn't clear that it was necessarily the increased precipitation and warmer weather that was causing this dynamic. It could have been contributed to by other things. But we had to ask ourselves that question. Is the reason why we're seeing so many people, so many adults who are ill because this mosquito-borne parasite has not, the population has not become or is not accustomed to it because of climatic factors.
I was just wondering about how climate change can impact food security and like what kind of health implications would be related to that.
Right, that's a great question. So I think by a number of means, climate change can impact food security. I think one of the big ones would be increased prevalence of and longer lasting droughts, which is something that has been observed. This, of course, creates a situation where crop yields aren't as good as they have been in the past. And that can translate into food insecurity for the families that depend on those harvests, as well as undermining people's livelihoods, which then translate into potentially into food insecurity. But I think there's more than one potential route by which climate change can affect food insecurity. Another one is conflict. So this is still an area of active discussion and research, but there is thinking that conflict is precipitated in part by climate change and the impacts of climate change. And as I've certainly seen working in many humanitarian contexts, conflict can have very significant impacts on people's ability to farm and on their ability to make livelihoods for themselves. So I think there are a couple of different means by which climate change and extreme weather can impact people's ability to access nutritious food.
So, drawing on more of, I guess, your experience, what unique challenges do healthcare workers face when dealing with climate-related health issues?
Yeah, that's a really excellent question. I think there are many, and that relates to some of the final slides in my presentation. I think that when healthcare systems, by and large, were set up, climate change wasn't really on the minds of those who were doing the setting up, right? It's only in the last couple of decades that climate change has even emerged as a concept. And it's really, I would say, only in the last couple of decades that, or yeah, maybe in the last couple of years, maybe the last decade, in fact, that there has been a broad scale understanding of how climate change is affecting our day-to-day lives. And I think that, yes, that as a result, there are lots of gaps in our healthcare systems when it comes to responding to issues related to climate change. So many healthcare systems do not have the capacity to deal with large influxes of people who are experiencing heat-related illness. During some of the heat waves in 2021, there were many news stories about this, about how hospitals were overwhelmed with people with heat-related illness. So I think that's one way that healthcare workers aren't necessarily furnished with the physical space, with the skills, with the tools that they need in order to manage some of the consequences of large-scale extreme weather events that may be linked to climate change. Then the other thing I think that's really important not to forget is this concept of moral distress. I think for many healthcare workers, they experience moral distress, which the definition of which is the distress that comes with knowing what the right course of action is and not being able to do it. I think in a lot of cases, healthcare workers, many of whom went into healthcare because they have good intentions and wish to help people, cannot take the right course of action in many circumstances because it's beyond their capacities, right? It's like we said before, climate change is not a one person it's not going to be a one-person solution. So I think that healthcare workers experience a lot of moral distress, especially when they are ensconced in systems that are wasteful and that are such a major culprit in terms of carbon emissions. I'm thinking in particular, just working in a healthcare environment, of all of the disposable tools, gloves, masks, et cetera, that we use. In the healthcare environment, we can be quite constrained with respect to taking the action that we believe to be right with respect to the environment.
Yeah, that kind of reminded me of our discussion with Dr. Rose Leishman, who went on a mission trip to the Central African Republic a few months ago. She talked about how there were limited resources in her work environment and how there were like so many people who needed access to healthcare in that facility, but there was just simply not that much space and resources. I just wanted to ask about since I've read about your biography, you've been to many places, including Congo, Central African Republic, and many other places. Could you share with the audience your favorite, not your favorite, but like the most interesting region you've been to, and what are like the most severe situations that you've seen in these places?
Hmm, that's a good question. I don't have a favorite. I think every place that I have ever worked has taught me something, for sure. Every place where I have worked has been unique and has presented different challenges and taught me different lessons, as I said. And in terms of the most severe, yeah, it's hard to say. Maybe I would answer this one just because I invited you to ask me about this earlier in the presentation. I'll say how some of these questions of climate change sort of presented themselves to me. I already told you about the malaria outbreak, which was in Democratic Republic of Congo when I was working there in 2015. But maybe I'll expand on that a little bit. This outbreak was called in by the healthcare workers in this area, a very remote region of North Kivu province, which is in the east of the country. It's a very mountainous region, and there are some villages that are extremely difficult to access, especially during the rain. The roads are not paved and they're in the mountains, so they can be quite challenging to navigate, even on a motorcycle, and impossible to get to by car. And this health post alerted the MSF program in Masisi in North Kivu of an unprecedented number of cases that they were seeing of severe malaria among children, of course, which as I mentioned earlier, is more common, but also among teenagers and adults. And so as MSF does in these situations, they put together an emergency response team and supplies and then headed out to the area. And I was part of that team. And it was quite remarkable to see adults and older adolescents who were so sick, because typically that's not what you see in an area that's endemic or where malaria is endemic. And as I said before, we're asking ourselves, why is this the case? Why is it that even older people are becoming so ill with malaria? And the thinking was, oh, well, possibly this is a result of the increased precipitation and the warmth that the area has received in the last couple of this season, and people were talking about this. But this is also an area that's affected by conflict. People were quite frequently obliged to leave their village and flee to safety higher up in the mountains. And so maybe this is what had happened with those folks, and they had come back down into lower altitudes and had lost some of their immunity. So we did have to sort of tease out some of these different factors, and it's never been made clear, or it's one of these situations where you can never really know, but you have to ask yourself those questions. Why is it that we're seeing these trends that we've never seen before in the past? Climate change maybe have some hand in changing these trends.
Yeah, I mean, that's definitely very insightful. And on the topic of, local populations and what's going on in these countries, I was just wondering from your experience, so in the regions that you have visited, like in Africa, have the local people noticed the effects of climate change? Do they feel affected? Like, do they know about climate change as a concept?
Yeah, that's a great question. So I think it really it depends, like so many other of the questions that I have responded to. It depends. I was recently involved in some research related to community perceptions of climate change and community responses to climate change in humanitarian contexts. And by and large, the people that we spoke to did know, they were very aware of climate change, gave in this research very astute and telling examples of how climate change was showing up in their lives and the impact that that was having on people's health. And they also had ideas about how climate change can be adapted to, how communities can be more resilient to the shocks that come along with climate change. So that exercise, being involved in this research, was really eye-opening and very encouraging, to see that not only is there a recognition, across borders that climate change is happening and that it's having an impact on people's lives and well-being, but also that there is a recognition and many ideas about context-specific mechanisms and means of protecting people against some of the impacts of climate change. And I can give you the link to that report if you want to link to it on the website, because the findings have been made public.
Yeah, we can definitely link it into the chat. Yeah.
Yeah, if you're interested.
Yeah, for sure. I was just thinking about well, as you just mentioned, how oftentimes climate change it's pretty obvious, like you can just feel it, like warmer summers, colder winters. But sometimes there are less obvious health impacts of climate change that people may not be aware of.
Expanding on the part about preparing for climate change, we did receive a question in the chat.
Mhm.
So, what does the healthcare system need to do to prepare for ongoing climate change? I don't know, maybe that means we have to, increase efforts to get rid of climate change or reduce it or take more, like, shield the healthcare sector more. Like, I don't know, what do you think that looks like?
Yeah, I think that is a great question. And I think the answer is multi-pronged. I think a very important first step is acknowledging the impacts of environment on health and making sure that healthcare workers do too. And so that healthcare workers, right down the um, hierarchy from your medical students like me to your healthcare leaders, that they're aware of climate change and environmental degradation and the potential that those things have to influence health. And then also, as I was saying before, preparedness and making sure that all of the necessary elements are in place for healthcare systems to be able to respond if there are these very big sudden events that influence health. And also that they are able in now and in the future to manage some of the longer term impacts of climate change on health. So I'm thinking, as we were talking about before, I'm thinking about the impact of climate change on nutrition, on cardiovascular health. You mentioned earlier, Jonathan, allergies. I think it's really important for capacity to be put in place with the specific objective of being able in now and in the future to respond to some of these impacts.
Yeah, for sure. Since, well, recently we've seen a huge rise in the use of technology and AI, even in the healthcare sector. So we have a question here in the chat that asks about if technology can play a role in addressing climate-related health inequities.
That's a great question. So I am by no means an expert in this area. There are people who are, but I think one of the exciting places where I have seen technology used for these purposes is in anticipating climate related shocks. So things like the integration of data on weather, on precipitation, on even on the spread or the habitat of disease carrying insects, to be able to project in the future when and where there might be outbreaks of infectious disease, or a large number of asthma exacerbations, or something along these lines. So the use of data and, of course, the attendant technologies to be able to better anticipate when there may be increased utilization of the healthcare system in response to needs generated by extreme weather and other trends that might be related to climate change and the environment.
Yeah, I think all this technology comes with more people knowing about the detrimental effects of climate change, obviously. And I'm just thinking, how can we get more people to recognize these consequences? Because, even the other day, one of my friends said to me, like, I don't really think climate change is as bad as they think it is, like, the winters are still pretty cold here. Summers don't seem that hot. Like, I just don't think it's that big of an issue. But
Mm,
that's not true. He also mentioned that, the Earth does this once every few millennia, and so it's just a natural cycle in the Earth. So, I'm thinking if there are people in my friend group that still believe climate change isn't a big issue, a significant population probably also doesn't recognize its consequences. So, how can you get more people to really recognize the effects, especially on vulnerable populations? We might be living in a part of the world where we don't feel anything, but in other places in the world, like, it's life or death.
mm. Yeah, I think that's where that advocacy piece comes in. And certainly as a future healthcare professional in your career, as it goes on, you will be at the front line. You will be seeing the kinds of impacts of healthcare, or sorry, of climate change that we've just been talking about today. I certainly, in my medical education, have seen this on more than one instance. I'm thinking in particular of the wildfires the last couple of years. I've seen a lot of people who are having respiratory exacerbations of their respiratory disease, linked at least in time to wildfires, which of course are likely driven by climate, or driven by climate change, right? So I think as we move along in our careers as healthcare professionals, we are in a very good place, or we're very well positioned to do that kind of advocacy, because we see firsthand some of these impacts that we've been talking about. And I think also, I'll just commend you for taking an interest in this topic, right? That's where it all starts, is, as I said at the very start of my presentation, asking why. Why are these things happening? Why are we having so many people come in with asthma exacerbations on this very hot and smoggy day? Why is all of this happening? And you've already done that by organizing this webinar and taking an interest in this topic. So well done. That's the first step,
Do
I
you
think.
think in our current world we should be using climate pessimism or optimism more? That is, I know there are kind of different approaches to thinking about climate change. Some people argue we should be presenting people with, the devastating consequences that climate change will pose in the world, and, say that we're doomed unless we take action now. It's kind of a very negative approach, whereas other people are kind of advocating in a more positive light. If we work together, we can solve this, we can overcome anything. Like, which approach would you say is more effective in your opinion in getting people to take action?
It's really important to underscore the opportunities, to highlight for people what can be done rather than what has not been done so far. I think that if you focus too squarely on the negative, then that can lead people to hopelessness and to, yeah, to a place of despair. And I think there's a term for this, and I can't remember what it is now, something like messy optimism. I think for me, that's the approach to employ, because we are at a place in history where there are many things that we could be doing on that bus that I talked about during my presentation. There are many opportunities that we could be taking in order to improve health equity and to mobilize people toward climate action. But it's also important, as you said, to be realistic and to take stock of what has happened on the sort of global stage over the last, few decades. Dr. Paul Farmer and some of his colleagues in an article I read recently called it the great procrastination, the epoch we've just lived through with quite slow change on climate action rather. So yeah, I think simply from my own experience and point of view, what I personally, the approach that I tend to take and that's most comfortable for me is this sort of messy optimism, let's call it, one that recognizes the opportunities that are presenting themselves for us today, for those larger projects of equity, social justice, and climate change, but that are recognizant of where we are, where we've been, and hopeful about where we're going.
I definitely agree. It's like a balance. Like, we need to let people know about the issues, but at the same time, if you're too negative, climate change and global health equity will feel like an insurmountable issue, and so people will naturally be discouraged to try to solve it or take steps to move in the right direction. So I think
Yeah, you got
this
it.
messy optimism approach is very valid. Yeah.
Mm.
I
I
think
do have one last question to close things off for today.
Mhm.
So, just wondering how global health organizations like Doctors Without Borders can advocate for climate action to address health inequities.
Yeah, that's a great question. I think there are a lot of organizations that are doing that. MSF is one of them. So I've had the good fortune of working with MSF on some of its climate change communications and advocacy. And I think that its general approach is underscoring the impacts on health that it sees that relate to environmental degradation, to changes in the climate, to extreme weather, and that sort of thing. So yeah, a kind of what I was describing before, but on an organizational scale, really using its proximity to people who are affected by these phenomena to advocate for, to amplify the messages of urgency that need to be heard on the global level, right? We are a ways away from meeting our climate goals at this time. The consumption of fossil fuels has not decreased in the way that was hoped for, has been hoped for in the years leading up to now. So, yeah, I think that is what organizations can do, just like, individuals, especially individuals involved in healthcare and treating patients can do. Use that privileged position that they have with people who are affected by these phenomena to amplify messages that relate to climate justice and health equity.
Oh, thank you so much, Sandra, for taking the time to chat with us today. You said a lot of insightful things that I'm sure our audience will really appreciate. And also, Matthew and I have learned so much from our discussion today. So thank you so much. This is the
Yes.
Youth Advocates for the Global Health Association. Thank you to our audience for participating, and to register for our future events, please visit yagha.org. Thank you so much.